We'll begin this morning with the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Good morning. Welcome to the December 9th, 2024 work session of the Shawnee County Board of County Commissioners. My name is Kevin Cook. I serve as the chair this year. Joining me today is Commissioner Aaron Mays. Good morning.
Morning.
Commissioner Bill Rippon. Good morning.
Good morning.
Mr. Eckert's our county counselor down at the end.
Good morning.
We have two items on our agenda this morning. We're going to start with a presentation from the Department of Corrections and discussions regarding mental health and the dashboard. So I'm going to turn it over to Director Cole at this time.
Good morning, Brian Cole, Shawnee County Department of Corrections. Thank you for this morning. Just kind of want to give a brief update and then show you one of the next steps that we've done in Shawnee County that I think everybody knows after many years of my being up here that one of the biggest challenges that we face not only in our community but in public safety is how do we efficiently and effectively manage those who suffer with mental illness. Specifically, how do we identify those who are suffering with mental illness? How do we get them to the appropriate treatment and services? But when they do find themselves incarcerated, how do we continue or the continuum of care? And that is one of the biggest issues, the biggest challenges that do face our agency in Shawnee County. I think everybody knows that we are in the process of building and constructing a behavioral health area, which is going to be, I believe, the next step in professional services that Shawnee County can provide, and I think demonstrates to the state and others our commitment. But one of the things that we looked at when it came to dealing with behavioral health and mental health services is how do we continue to be transparent to our community? How do we go to the next step when it comes to preparing and providing services? And one of those was to be able to engage and to become fully involved in the Stepping Up initiative. Stepping Up initiative is a national initiative to reduce the number of people with mental illness in jails. It allows us to create strong, data-driven goals to create concrete results in counties of all sizes. That in 2021, Shawnee County, with the support of our commissioners, we entered into a home resolution that put the stamp on our commitment when it came to being involved fully with Stepping Up. I'd like to say, first and foremost, again, thank you to Teresa and Dr. Locke, that one of the beginning steps that we did in here was our sequential intercept mapping. And that was the beginning of saying, where are the gaps that we have when an individual with behavioral health falls in the public health arena, meaning, or public safety, meaning that if we have 5 intercepts before jail, at jail, in court, discharged, and then out in the community, what services can we provide at each of those areas? And we found a tremendous amount of gaps. We found that Shawnee County was doing a lot of good things, but we found out there were gaps. For example, a crisis center. Vallejo has a crisis center, and they're looking at expanding that, my understanding. We needed a alternative sentencing program. We have an alternative sentencing program. But there was a lot of work that needed to be done with discharge planning, and that's what we're continuing to work on with our health department, working with Vallejo. So we're looking at those gaps. The next step was in 2022 with the Department of Corrections, our valuable partners, and Vallejo. Shawnee County became an innovator county, which means that we have met all the hoops and hurdles that meant we have a home resolution. We had data-driven process in place to track and monitor what we are doing in Shawnee County, which is setting the benchmark for other counties. We work very closely with the other big counties in Sedgwick County, Johnson County, Douglas County, you name it. And one of the biggest front runners is Reno County when it comes to stepping up. So we're right up there looking at targets and what we have. But one of the things that when we started working is one of the things we thought was missing was how do we get this information to public? How do we get this information out on our websites so we're able to do that? Fortunately, I had the blessing of working with Brandy. That she worked at the Department of Corrections many years ago and then went on over to IT to work with Mark and Andrew. And one of the things that we started talking about was how do we create a dashboard? How do we create a dashboard so our public and our citizens and our stakeholders can review the targets? So I was part of the initial stepping up and working with the community. And IT is here because this was not just an easy plug in a couple numbers and do. So Andrew and everyone is here to answer any questions you may have regarding how that process went. But I was kind of sitting there with the other several different boards that I'm on. Major Steve Willis came to me and said, I would like to be more involved in stepping up, because they're stepping up now that's going to be taking juvenile and even into community corrections. So I stepped aside so I could continue to work on the other boards and let Steve Willis take over that. Steve's going to come up and talk to you about our set, measure, and achieve, which means what goals did we set, how do we measure them and achieve, and then also is going to introduce to you Brock Robert, who is our data analyst, who's the one who is putting all this and can interpret and tell you what you're actually looking at. So I wanted to bring Steve up to let him start talking about the specific dashboard. And again, please speak with our friends at IT because they put a tremendous amount of hours into this. So thank you, Steve.
Good morning. Steve Willis, Department of Corrections, Deputy Director overseeing community corrections. Stepping up has always been a passion of mine. When I was the Director of Community Corrections in Emporia, this was something that we started while I was there. And so to come to Shawnee County and to be able to be a part of this has been a big deal for me. I do want to talk about the Set, Measure, Achieve initiative. This is a framework that was developed by the Stepping Up initiative in general from a national perspective. Its initial goal was to help reduce the prevalence of people with mental illness in jails. It focuses on measurable goals, clear progress tracking, and focuses on evidence-based strategies. This is something that Brian was talking about. It aligns directly with our Shawnee County's ongoing commitment to reducing mental health within the criminal justice system and the jail specifically. The question to me was, when I started getting into this, why does this matter? Currently, within our nation, there are 2 million or more than 2 million people with mental illness that are booked in our jails annually as a nation. Locally, Shawnee County has seen increasing utilization of our resources for individuals who have mental illness, and that is, it's tough in jail when you have a mental illness. You're not necessarily receiving the services that are in the community that are focused for your benefit and for your health. There's a big cost and impact, and I know that's been a conversation within this community regarding those who have mental illness being sent into jail. They tend to be there longer or have been in the previous, which is one of the reasons why we have focused on trying to reduce the mental health individuals in that jail. So Set, Measure, and Achieve sets up 3 components. One, set the goals. Identify what you want to achieve and then start building from there. For an example, we want to reduce jail bookings for individuals with mental illness by a certain number. Let's call it 25%, something to that effect. Shawnee County sets those goals in line, and then we start to identify how we can achieve that. This dashboard is a clear, direct effect on setting those goals from the very beginning. We have to be able to measure data from these goals. We want to be able to show the community that what we are achieving within our Department of Corrections regarding mental health in the jail and in the community, we want to be able to show that what we've set out to do is working. And the only way to do that is by identifying the people that need the assistance and to show what the direct impact is for us. And you'll see within the dashboard, you'll have identified connections to care. As somebody comes in through the jail, they are working through assessments and procedures where we have people within the community who have been identified that can help in certain areas. And that's a connection to care, whether it's we have somebody in transport driving somebody to the mental health center, having a medication appointment or something to that effect. Those are all connections that we set as a goal to provide for somebody who is in need of that mental health service to help reduce their mental health so that they can live a healthy, happy life within the community. The last thing is achieving those results. Now, you can set a goal, you can talk about the data, but the important thing is achieving that goal and being able to show the community that that's working. So you've heard Brian step up and thank IT and others for the work that they've done within the Shawnee County Stepping Up Initiative. And I think that's the important part. It's not the Department of Corrections Stepping Up Initiative. It is the Shawnee County. And in order for the jail, community corrections, or anyone to see a reduction in mental health services or mental health people with mental health illness coming into the jail, it takes a community in order to do that. What you'll see in this dashboard are many things. Average jail population with SMI. The goal is that we reduce all people coming into the jail, but we ultimately want to reduce those that have mental illness coming into the jail. And the way we do that is reaching out to our mental health providers, identifying how we can provide quicker services and what we can do before they get in. Two things that I'll tell you that we are working on within the community. One, you know about the Community Corrections Grant that provides 2 mental health therapists within the corrections department to provide immediate services for those who are in mental health crisis. Those directly affect community corrections probationers who ultimately end up in jail. We don't want that to happen, so that's one clear initiative. The other one is we've partnered with Mirror in different ways, but we will start housing Mirror in the jail where somebody enters the jail and they will immediately start an assessment of services within the community. We have a new reentry provider within the jail that immediately works with those that will be coming out, identifying those connections to care as well. So in 2021, when the Stepping Up Initiative became active within Shawnee County, the set process became in place. What do we want to see happen? We needed to make sure we knew what data to measure. Now we're to a point where we have a dashboard to show the public. This is what we want to achieve, and now you can now follow along and see where we're at. So I'll pass this on to Brock Robert, as he is our data analyst. Let him share a little bit about some of the ins and outs of this, and please ask him some questions. I know he's really excited to be up here. And we'll stand for any questions at the end. Thank you.
Thank you. I'm Brock Robert, the data analyst for both Community Corrections and the Department of Corrections. I want to start off by thanking IT for helping me and designing and building this whole thing for us. I'll start by talking a little bit about the dashboard, start with jail bookings. That one's pretty self-explanatory with just the number of admissions that we see throughout each quarter. One of the biggest things that I took away from that is from 2022 quarter 4 to last quarter 3 2024, we saw an increase from 10% of the total bookings being classified as SMI to now 26% being SMI. For the second portion, it's average days in jail, also known as the average length of stay. Starting off, we've done a lot of, I've seen a lot of change here from 62 days average for an SMI inmate down to about 30, which is good improvement, getting closer to the average there. Next, for the average daily jail population, we started off at about a 37% of the total jail in 2021 to now about 41.6 as of 2024. All of these are showing just the comparison between the SMI and non-SMI numbers. I'll skip over recidivism for last. For the connections to care, we have, these are kind of collected and brought to me by the discharge planner over at the jail with Armor Health. And like Steve talked about, it's behavioral health referrals, assessments, and the different medication that they can be prescribed while in jail. For recidivism, we're kind of waiting for a statewide calculation to get a firm number on this. This is kind of our way of putting a number out there with our best information that we have right now until the Stepping Up initiative comes up with a complete definition for that. So what we did is anyone booked from January 1st to December 31st, multiple times that year is considered recidivism. We've considered adding a non-SMI column to that to kind of show the comparison between SMI and non-SMI. As you can see, the SMI for 2023 was 48.9%, where non-SMI was 26%. So as you can see, a big difference for how often they're booked in, if they're SMI or non-SMI. I think that's all I have.
Questions?
I do have a question. I don't know who this is a toss-up question for the group. Who determines who is a serious mental inmate?
What we did at the that's a great question. What we did at the very beginning is that every county that's involved in Stepping Up comes up with their own shared definition of what that is. And that would basically means with the DSM that keeps changing, but basically what we did is that we did a definition is our shared definition in Shawnee County, and then when we met with all the counties, we came up with one shared definition for the state of Kansas, which is defined as a mental, behavior, or emotional disorder resulting in serious functional impairments which substantially interferes with or limits one or more major life activities, that the burden of mental illnesses is particularly concentrated among those who experience disability due to SMI. So we have that framework. Then our behavioral health professionals will determine exactly who meets this criteria. Most of the time you're talking about those that are diagnosed with border or bipolar, major depression, and schizophrenia. So those are kind of the three biggies, but our behavioral health in all of the agencies will define who actually meets those. If we were to say just anybody who had any type of mental health issues, and which some jails do, you'd be looking at around 80 or 90% of their population deals with some type of mental health. But for us, we even drill it down a little bit farther when it comes to those very serious mental health issues. So our mental health staff follows, every jail that's in Stepping Up follows this same shared definition. And what Brock mentioned is that for each one of the goals, we want to make sure that we're comparing apples to apples, so to speak. So we are now trying to get a shared definition on recidivism. Some people will, in some counties when we met, for us it's anybody that comes in on something new. Some book in or use it for anybody that comes back for any reason. Some will say, we're not going to do it if you only come back, if you have to come back more than 3 times. So we're trying to get all the counties together to come up with a shared definition. But to answer your question, Commissioner, that who decides that all is behavioral health based off of this shared definition?
Commissioner Mays?
So now we know who decides that, but I guess I'm questioning also, when is that decided? Is it at intake? Is that when they book out of jail?
No, it will be, yeah, that's a good
Or
question.
just over the course of their stay? I mean, I could imagine.
All of those.
Like you mentioned bipolar, I could see somebody coming in feeling great, and then a couple days later, they're in a crisis. So, I mean, is that just, how do you guys do
It's not just
that?
anybody that's in crisis. What we do is we work closely with the health department, Vallejo, that anybody, we do a jail brief intake form on every inmate that comes into jail, whether they stay or not. We want a complete picture of everybody that walks in that facility, and it is scored by our behavioral health staff. So the stats we give, whether they come in or get out, if they meet one of these criterias, they will be listed as somebody who was booked into jail. Now, this is to help, I think, to kind of, to help with your question, sir, is this helps us to catch though who might fall through the cracks. We might get a person who comes in and says, is getting out and might be totally fine. They're on their medication, they're not in crisis, but they still will need services And so we will find out that they're booked into jail. But if somebody comes into jail and they stay, they immediately see one of our behavioral health specialists. They're in, they get screened immediately. We start working with release of information for medications, treatment plans with our local providers. But all of the above on that, we do that at the everything takes place at the very beginning of booking. And when you hear about incident command and trying to recover from the very first time they, when we get on site of things, we start addressing things when they come into the jail. So it starts right from the very beginning.
Okay, thank you.
Now, when you look at these goals, we have like a 5%, I believe for jail bookends, a 5% reduction and 5%, and a lot of these we are meeting. But when Steve talked about a total community effort, that's what it is. Because I can't just walk to the sheriff's office, the highway patrol, the police department and say, hey, we need to reduce our jail bookings by SMI, so quit arresting people. We need to start looking at what resources we have. And this includes working with the courts, who we work with both the municipal and the district courts very well on doing that. But we have people, this is not a soft on crime approach. This is to provide services for best practices. So I don't have the county counselor asking what services should we be providing that we're not. But we're working closely with our law enforcement partners on how do we divert people away. We're working very closely on reducing the average length of stay and our jail population. But to have 41% of your serious and persistent mental illness, you've heard Commissioner Cook talk more than once, it costs more to hold those individuals because of the medications. And we spend probably close to $25,000 to $30,000 a month on medication. And a great majority of that, the highest expense probably is HIV medicine, but you're talking with about 5 psychotropic medications. And that is very expensive. When we go to injectables, they stay longer, they're easy to administer, and this is a work in progress. But now it gives us some very good goals. Some jails just do it quarterly or annually. We do it quarterly. And we have a great deal of the people from the state and KDAD, who we work with very closely, the people of the city courts and the city council. They're all very interested in our statistics to what we're doing and how we compare to other counties. And overall, stepping up, our data analysts and everybody will be putting our data into the computer, and then they're going to start reporting how we compare to Shawnee or Douglas County and what their numbers are.
So on the jail bookings, when we look at those numbers, is recidivism taken into account on that? Is it?
Oh, yeah.
So are those unique bookings, or are those
No, those are everybody.
individual people?
Those are individual people. So
Okay.
you might get a person that gets booked in that says, might get booked in 10 times.
Mm-hmm.
Usually, typically, we book in about 9,000 people a year. On average, about 3,000 are brand new people that have never been to jail. The other 6 are people that have come in on multiple cases. Now, you have to understand, when we do, let me back up. There is going to be a link that we've worked very closely with IT on that gives, we want to give the dashboard, but if you want specific information on race, gender, age, and things like that, that will be a link that you can go to and get a 4-page, very specific deal. But that goes to every booking that comes in. But when you look at, on that form that we have, it'll talk about charges. Biggest charges we have with mental health, city bench warrants, technical violations, probation and probation, both court services and even ISP. So we have to work closely with those partners on how we can serve our people that are on probation to keep them from offending, committing new crimes, or not showing up to their meetings or a dirty UA or things like that.
Well, the reason I ask is because when you look at this, the jail bookings for SMI is almost double in the last 2 years, and then the average days in jail is about half in the last 2 years. And I think it'd be easy to, without knowing that information, to draw the conclusion that there's this revolving door, that we're letting people out and then they're just coming right back in. And so I want to make sure that that's clear somewhere in here, that that's not exactly what's happening.
No, it's not. I mean, the issue is that with you know, our stakeholders are very busy, and what we're trying to do is work with our, those that are getting out to getting them, if they're homeless, getting them to adequate housing, getting them an appointment real quick, giving them enough discharge medication to last them till their next appointment and things like that. But unfortunately, we do have some of those that do come back in. But one of the things is that I wanted to look at was what our top 10 charges on what was coming in. And you'll see bench warrants as a very high with the city, which means they're failing to go to court. So we have to start addressing, why are they failing to go to court? Could be transportation. It could be that they go into crisis. They stop meeting with their care provider. And that's why with our crisis mobile response team in Vallejo and the health department, they do community outreach just to knock on doors to say, Bill, are you going to your appointment? Are you taking your medication? Sometimes they're very responsive. Sometimes they get afraid that they're going back to jail, and then they will not engage in services. So that's one of the things. What's also going to be huge on this is breaking the issue of stigma. So we can start that. I don't want you to be afraid to tell us that you need help till we can get back. But is it a revolving door? I don't think so, but it's certainly, this gives us a picture. So at the end of the year, we can start setting goals in our stepping up board in our community and start reaching out with the law enforcement and saying, these are areas of what we're seeing and where we're tracking that, and things like that.
So, one more question and then I'll be done. So in 2025 budget, we allocated additional funding to the courts to start the AOT program.
Mm-hmm.
Is that something that you guys will keep data on as well, or
We
is
don't
this?
keep that because that's something on the outside. They will keep that data when it comes to those going to court, just like at the municipal level, they'll keep in Vallejo, they'll keep the stats on who goes through their alternative sentencing program. So if it's a specialty court, we try to work with them on finding people who would qualify to get in so they can get out and go to the courts and get services, but we won't keep track of those statistics, just like direct court, we don't keep track of those statistics.
Okay, thank you.
All right, Brock, I'm going to have you come up and go back through this dashboard with me.
Okay.
Because Commissioner Mays has given me enough time to kind of digest this. All right, so if I'm looking at our jail bookings,
Mm-hmm.
it would appear that you have about 2,000 bookings per quarter. That's going to be about 650 or so per month, breaking that into a 3-month cycle, right? So am I following that so far?
Yeah, that's fine, yep.
Okay, and if I go directly below that to my average daily population, I'm at about 520 on a daily population at the jail, give or take. So there's going to be a number of people that just get booked in and then booked right back out, so they're not staying at all.
Mhm.
Is that accurate?
Yes.
Okay.
Totally.
Is that what my data is showing me?
Yeah.
Okay, so then what we've looked at, the average days in jail, we see that number declining throughout the quarters, right?
Yes.
Okay, and this is where Director Cole and Mr. Willis were talking, Deputy Director Willis were talking about working with Vallejo outreach crisis and looking at what we can do to make sure that we have services provided so that they're going to service providers. Is that, but your numbers are, but that's not your area, that, you're just tracking what the data says?
Yes. Mhm.
Okay, all right. Do you know what the uptick was in second quarter 2024?
For the average days in jail?
Yeah.
I do not know the exact reason why
Okay.
it was up.
All right. And then, again, as Director Cole was talking about, the recidivism just means that you were booked in within a 12-month cycle more than once.
Yes.
Okay. But it doesn't tell us how many times. You could have been booked in 10 times or 2 times.
Yes. I think that is a good thing too, though. And I'd also like to look more into what if they were booked in December 31st and January 1st of the next year. I think there's definitely some room, and that's why I think we're waiting more for the statewide definition on that.
Sure. And as far as that booking goes, I mean, it could be you got booked in for driving while suspended, or you got booked in for theft. It's not going to differentiate between the two.
Yes.
Okay. All right. The final dashboard, your connections to care, those are people that have services already lined up or provided?
Those are that were initiated by the discharge planner to help those with SMI and non-SMI once they're released.
Okay. And I think we'll be touching on that probably, or I would anticipate us touching on that briefly, maybe in our Board of Health meeting, talking about, again, tracking some of that data and some of that information. Okay. That's what I needed to kind of look at. I appreciate it. Thank you, Brian.
I had
Yeah,
one more
Commissioner
question. In that last dashboard, the connections to care, the
Just for
difference
Brock?
between,
Mike, come back up here, Brock.
stay flexible. Between the first and second quarter, there was quite a jump. Was there new services that were implemented that?
Well, I think a lot of it was just setting our goals and setting our processes in place and what actually we were going to count towards connection of care. And so that's why you started seeing more, because when we started talking to our technical center with Stepping Up, if we say, here is the mission, or here's how you get to the health department, and give them a map, they counted that towards a connection to care. So it wasn't just, we got you an appointment, so we started adding more. So it was new services getting involved and putting more eyes on there, and also with the hiring of a new a reentry officer and things like that. When it comes to those average daily population, also, we do it at a certain time. So if you're booked in while we do our count, you may be in there for a couple hours, but you will be counted towards that average there. But we do keep individually, we have the list on how many times, we have the actual paperwork on how many times a person who has come in. And also, we do keep track of the crimes. Basically what our top 10 crimes of our SMI and non-SMI. And to be honest with you, they're very similar. They're very similar.
Questions, Commissioner Mays?
Yeah, so that spike in the average days in jail, I can't speak anymore, I guess, but is that something that could be just affected by the court's backlog? I mean, if you know, when the air conditioner broke, you know, they were having less people in the courthouse. Is that something that could affect that? Or if a judge goes on vacation for a week, I mean.
Well, you'll see in the average stays is 62, whatever. A lot of that was impact, we were still coming out of COVID. And so that impacted a great deal when there was no movement in courts. You had people that were not coming to the jail, not saying that anybody was delinquent in their jobs or anything in the community, but we were establishing who was coming into the jail. You had a lot of fear of people coming into the jail, so we were in the middle of constructing our Zoom stuff, so there were a lot of things on hold. And so now we're starting to see a little bit better resemblance of the timeliness, because we have somebody from Vallejo that comes in every week as a liaison, and they come in and work with our population.
And then also, you know, with the SMI average length, is that also affected by the state and their ability to do, you know, competency evaluations?
Yeah, and that will be the next deal, is looking at, as we go, is getting people in there for restoration, you know, and looking at, you know, Major Phelps and I will be speaking with the Shawnee County delegation today, and specifically addressing, you know, the recent news regarding that there was the settlement with the ACLU, with KDADS and all that kind of stuff. We're going to be talking about Shawnee County, but making a proposal to them about funding for jails and seed money for competency restoration to either do things on site, like which we're trying to do, and we're very close to getting our own restoration program, and helping counties implement programs locally, so the smaller rural counties can get people to Larned quicker, when agencies like us might be able to have, instead of have 30 waiting, maybe we only have 5 that are waiting to go there because the other 10 or so are getting the services here in Shawnee County.
Okay. Questions? All right. Thank you, Brian, for all of that information.
Did you have any questions for IT?
When are you going to have the other dashboard information up? Is it up now? Is it active?
Not all at once.
And nobody escapes today.
Hi, Andrew Mumash, Shawnee County IT. The plan right now is to launch this for the website and the supporting information, that detailed information, at the beginning of January. So it should be January 1st. Got a few things to line out there, but that's our timeline for that.
All right. Appreciate it. Thank you. Any other questions? All right. Thank you very much.
Thank you.
Our second agenda item is to go into our Board of Health. We are by statute required to have annual meetings of the Shawnee County Board of Health. And this would be one of those meetings where the Shawnee County Board of County Commissioners is serving as the Board of Health. And so we're going to be convening and having that Board of Health meeting now. I'm going to turn it over to our Health Director, Teresa Fisher.
Good morning, Commissioners. Thank you for the welcome to our December 9th. We have been doing Board of Health meetings twice a year, so we're back for our fall and winter edition after not having been here since spring. So thank you, Commissioner Cook, for reminding everyone that you do serve as the Board of Health and why we come and present this information. So I really look forward to these meetings, and we use this as an opportunity to not only showcase what's going in our department, but as you look out, you'll notice that we typically always bring some community partners because that's where a lot of our work is embedded, is here in the community. And it's a nice opportunity for us to showcase that. So I'm going to give an overview about what you guys are hearing today and who our speakers will be. So you will be hearing from Carrie Dels. Carrie serves as our Clinical Services Division Manager, and Brittany Blattner, our Epidemiologist. And I guess in the theme of today, we are also bringing a dashboard to present. So you guys have seen our opioid dashboard, but we're introducing it today and going to give you a rundown of what that dashboard looks like. We did not work as closely with IT. We actually worked with our GIS system, and they'll be introducing that. And then you'll also hear an update, just an overview. We applied for 2 different Kansas Fights Addiction grants, and so we're going to give you just an update about where we're at in that process. You'll also hear from Shelly Ramos. Shelly serves as our Health Promotion Coordinator, and I'm really excited. Shelly is going to be discussing our recent What is Public Health mural. So you guys have been hearing about that for quite some time. She's going to give you kind of the steps that led up to the culmination of the project, and hopefully if you haven't seen it, you'll get a chance to go by, although I won't steal the show, but it's not quite finished. You'll also hear from Craig Barnes. Craig serves as our Community Health Outreach Planning Division Manager, and Carla Hedquist, who's the Director of Community Health Engagement at Stormont Vale. They're going to be providing a brief overview of the Community Health Needs Assessment. I know all 3 of you have received your most recent copy that is hot off the press as of just a few weeks ago. And then last but certainly not least, we've got Sarah Carnes. Sarah serves as the Director of Live Well Shawnee County, and she's going to be providing an overview, kind of our recap of the year and all the good work that they did, and then a glimpse into the year ahead for Live Well Shawnee County. So with that, I'm going to turn it over to our first presenters.
Good morning. I'm Brittany Blattner, epidemiologist at the Health Department. And I'm going to tell you about our new public-facing overdose surveillance data dashboard. This is what the dashboard looks like. I'll show you its features in a moment. It's updated monthly and accessible to the public as a way of keeping them informed of overdose trends. This was modeled after Reno County's similar dashboard. They've had great success in overdose prevention efforts, and their dashboard has been a part of that as it's made the public aware of the issue and informed community partners of drug trends. So I'll open up the dashboard here. Thought I would. Is this not working?
Is it linked?
It is, yeah. Sorry, it's not opening.
Can you right click?
Or does that just not work? Just go without it then.
Can you just finish it?
Oh, let's see. Nope, not human resources. You can navigate from there? Okay. Let's see. My apologies for that. This is the dashboard. This follows Shawnee County going back to 2020. You can see up here the filter by date. That allows you to select specific timeframes that you want to look at for data. And so going from January 1st of 2020 to now, we've had approximately, you can see, 5,200 overdose occurrences and 462 naloxone administrations. For those who aren't aware, naloxone, which has the brand name Narcan, is a medication that's administered to rapidly reverse an opioid overdose. It's often used by first responders in the event of an overdose when opioids are suspected, but can also be purchased over the counter as a nasal spray and administered by anyone. Finally, we've unfortunately had 42 overdose fatalities in this time frame. Here's a chart that shows these 3 variables by month. You can hover the cursor over individual bars to see the numbers and dates. This chart here shows the types of drugs suspected by percentage in these overdose events. We include alcohol, but for most of the drug overdoses in Shawnee County, they have been from methamphetamine. Down here shows the drug type numbers by month. It's important to note that there have been some data discrepancies over time due to errors in the system or changes in how it's reported, which is why you see this decrease in overdoses over these few months in 2020 and a sudden jump in suspected drugs in this chart. At this point in May of 2023, the reporting system started adding more suspected drug data that wasn't available prior. We can find syndromic data under this tab. This chart shows the number of emergency room visits that are opioid overdose or alcohol poisoning related by month. Finally, notes on data tab explains some of the data discrepancies I described and gives the data sources, which I'll tell you about next.
Board of Health there in the corner.
Primary data source we use to populate the dashboard is the Overdose Detection Mapping Application Program, or ODMAP. ODMAP is a secure mapping tool that displays suspected overdose event location data and provides near real-time surveillance of suspected overdose data. It's only available to government agencies serving the interests of public safety and public health. ODMAP data is input by the Kansas Board of EMS when they respond to an overdose event. They include the date and time of the incident, location, the outcome, whether or not naloxone was administered, and if known, the suspected drug type involved. You can get an idea of what it looks like here. The events are placed on a map so that we can identify hotspots. The other data source we use populates the emergency department visits, and it's called the Electronic Surveillance System for the Early Notification of Community-Based Epidemics, or ESSENCE. ESSENCE is a secure web-based syndromic surveillance system designed for the early detection of disease outbreaks, suspicious patterns of illness, and public health emergencies. Data on ESSENCE is input by hospital staff and utilizes medical records from emergency departments and urgent care facilities. It's only available to authorized users. This is an example of what an ESSENCE report looks like. This is for all drug-related visits in the state over time. In addition to overdose data, we're planning to add a resources tab to the dashboard that will include information such as addiction and recovery sources with links to treatment services and support groups, naloxone distribution sites, availability of other harm reduction supplies, mental health first aid training, and safe prescription drug disposal sites. So with this dashboard, we're hoping to bring awareness to the overdose burden in our community and provide the public and stakeholders with current overdose trend information, as well as offer resources for prevention and recovery. I'll pass it on to Carrie.
Thanks, Brittany. Carrie Delph's Clinical Services Division Manager, and I'm just giving a brief update on the Kansas Fights Addiction grants that we have brought before you over the last year. So we have applied for the Kansas Fights Addiction RFP3. This grant was geared towards treatment, recovery, harm reduction, and linkages to care. The health department really focused on the harm reduction piece in this grant. Our goals included expanding the number of Save a Life stations, expanding partners that are receiving harm reduction supplies, purchasing and operating a harm reduction vending machine, and then advertising the overdose data dashboard that Brittany shared with us, and the availability of those harm reduction supplies. The total funding for RFP3 is $6 million, with each project maximum award of $300,000. Our request was just over $186,000. There is no match required. You can see we submitted this in August. We should have had an award notification in November, but because of the number of projects they received, KFA was looking to see if there was maybe additional funding for projects. So we're hoping to hear very soon. RFP4, again, focused on prevention, providers and health systems, public safety, and first responders. Our grant was written towards those prevention strategies. It included activities like conducting a community assessment, creation of that harm reduction resource portal, very similar to what we did with COVID supplies, like tests or masks. We also wrote to create a position within the health department for an overdose fatality review board. And then, as Brittany talked about ODMAP, we'd like to expand the number of entities reporting data. Total funding for that proposal was $4 million. We requested just shy of $200,000, which was the limit, and we would expect notification in January. Happy to answer any questions regarding the dashboard or our grant applications.
Can you go back to the RFP3? Right there.
Nope.
What is the harm reduction vending machine?
So they've been used internationally. We are seeing more in the US. These are kind of similar to drink or snack vending machines, but they have harm reduction supplies like naloxone. In communities where it's allowable, they may have like needle exchange or syringe services.
Where would we see something like that? What's the contemplated plan for that?
We would need to identify a location. So working with partners, looking at our data, where are overdoses occurring, where would the vending machine be most useful?
I mean, are we anticipating that I'm gonna be walking into Walmart at some point in the future, and I'm just or at Dillon's, and I'm going to see a vending machine hosted by Shawnee County Health Department where I would have that ability there, or is it something that would be at a convenience shop or a Walgreens? What is it that we're anticipating?
We would certainly want something that would be accessible, but again, there is that stigma around drug use or harm reduction even, just as a whole. So really looking, I think, to what other partners have done or what other jurisdictions have done. It's not always going to be the same, but yeah, looking to what has been done, what's been successful.
Okay. Commissioner Rippon.
You took my question.
Commissioner Mays.
I don't know how much one of these vending machines costs, but, you know, I mean, I might be interested in looking at just taking that cost and putting it towards more Narcan, you know, and just giving it away. So I know that it's something we need more of in the community, out there, and so whatever we can do to, you know, get that out there, I think is good. But I'm interested in some of the data here, looking at the drug overdoses by type. I'm surprised at the number of alcohol overdoses, but I'm not surprised by the methamphetamine. It seems like, you know, we hear about fentanyl a lot, but it seems like meth is still kind of the really bad stuff. And then when I look at the oxycodone has its own category, is that taking into account just all opioids or just one?
That is oxycodone specifically.
Is there a reason why it's separated out?
We are still not entirely sure the direction we want to take that. Oxycodone is a very small percentage. So there's a good chance that in the future we may decide that we want to include that in a different category.
Okay. Okay. That's all I got.
Any other questions? All right, thank you very much.
Thank you.
Good morning. My name is Shelley Ramos, and I'm the Health Promotion Coordinator with the Shawnee County Health Department. Thank you for having us today. What is Public Health and Art Mural Project began in 2020 when we received additional funding from Arts Connect. In 2022, we proceeded forward with conversations with our internal partners within facilities to determine what materials were necessary for us to install this project at our J.P. Lewis office. After several conversations, it was determined by facilities that we did need to invest in some aluminum paneling, which resulted in us having conversations with Cine Company and then requiring bids from them on that pricing structure. I do want to say, as we were talking with Cine Company, we were also meeting with muralists and identifying the appropriate partner, which is Sarah Meyer, who has a lot of work throughout the Topeka community, most notably at Brown v. Board Historical Site in the Noto Arts District. After determining our muralist and getting pricing structure for the paneling, we were able to proceed forward with looking for additional investors. And thanks to the generosity of the Topeka Community Foundation as well as Live Well Shawnee County, we were able to proceed forward with our timeline. As you can see from here, we had our community conversation in January of 2024. In 2024, we invited various community partners to join us. How we identified those partners was just simply reaching out to the public through our social media channels, while also capitalizing on our partnership with Live Well Shawnee County and inviting those partners who serve on coalitions. We also invited surrounding neighborhood improvement associations to also participate. The community conversation was facilitated by Lisa Staley with the Topeka Shawnee County Public Library, and we had 22 attendees who represented various entities in the community, including Vallejo Behavioral Health, the Oasis, the grocery store Oasis, as well as parents as teachers. From those 22 individuals, we had over 30 pages of notes, which allowed Sarah to begin drafts of the mural project itself. And then through those drafts, we were able to submit those to our colleagues within the health department, not only leadership, but we also encouraged all personnel to take a look and share their voice at our Workforce Development Day in April. After several conversations and going back and forth, the summer of 2024, we were able to identify option 7 that you can see here on the screen as our mural project. After identifying that project, we were able to proceed forward with the rest of our timeline. That includes scheduling a paint day. Our paint day we scheduled for Friday, November 15th. And as you can see on the screen, there's an interesting way of approaching this. We didn't want those who were interested to feel uncomfortable with the art process. We wanted them just to have fun. So it was almost like a paint by numbers aspect. We also invited the community through our social media platforms and ensured that we reached out to all of our investors and those who attended the community conversation as well. In that time frame, it also allowed Sarah to also begin preparing the panel, for the mural. And then on Monday, November 11th, she put the mural itself up. And I'm not talking about the painting itself, it was the tracing of the mural. So that on the 15th, this is what everyone saw, all of our participants. Those participants included volunteers, personnel, and community members who were also attended, like I said. And then on November 15th, we had our paint day. You can see a lot of smiles there. Everyone had a lot of fun. The one thing, the consistent theme we heard throughout the day was pride. Everyone had had a great sense of pride, not only for the organization they work for, but just being allowed to take part in the process. And this is our mural today. As you can see, there are a few tweaks that need to be done, but due to the time of year, we've opted to wait till spring 2025 to complete it. So please stay tuned. At this point, does anyone have any questions or comments?
Nope. That's great. Keep going. Thank you.
Thank you.
I will say on the mural project, this is a long labor of love. It's been a topic of conversation, as Shelley mentioned, for many years. So it's really exciting for our agency to finally see this coming to fruition through multiple different layers. First, on the brick itself, adding those panels later, working with our muralist. And I mean, she's been there from the get-go. And so that's what's been so exciting. She's stuck with us through this entire process, and we're really excited as an agency to have this come to final fruition. So, all right, the exciting stuff, right? So now we're getting to the community health needs assessment. So I promise you've heard from me and from Carla, my colleague at Stormont Vale, talk about the needs assessment throughout this entire year, because this has been the year of the needs assessment. So just a really short update to end the year here today, to kind of tell you a little bit of what we accomplished, and really more so to look forward to 25 and how we're going to use this information. So you've seen this slide before. We presented it at the last Board of Health, but just as a refresher, needs assessment, what is it? It's our systematic process of evaluating the needs in our community. We do a great job, I feel like, of kind of a one-of-a-kind perception survey where we really get primary data. We get about 7 times the engagement from the next community in the state of Kansas on what they get on their primary survey data. So we saw with our neighboring county getting roughly around 600 to 700 responses in theirs, where we got 3,800 responses from our primary survey. And so that is what's so exciting about, because that is something, again, our community is passionate about, telling their story and what they see as their gaps, their barriers, and their needs as it relates to the health of our community. So we use that primary data, we use secondary, tertiary data, and pull that all together to then do a final data analysis of what truly are the needs in our community. So I'm going to invite Carla up. She's going to talk a little bit about the steering committee. You saw this, kind of some changes even for 25, give you an overview of the data, and then we're going to talk next steps.
Good morning, Commissioners. Carla Hedquist, Director of Community Health Engagement at Stormont Vale Health. And community health needs assessments are required of multiple organizations by different entities. So it's required of nonprofit hospitals, it's required of the public health accreditation body, it's required of certified community behavioral health centers like Vallejo and Family Service, it's required of federally qualified health centers. So it doesn't make sense, although some communities do all their surveys separately. As long as I know, we've worked together, and that makes much more sense, and it makes it a much more robust survey. And I think that leads to our better response as well. So we doubled the size of our leadership table this year because of CCBHC requirements and some other entities that came to the table. So we were thrilled about that. In 2025, we've already added KDHE to the leadership planning table for the next iteration and for the CHIP process. So really excited about all of the organizations that are involved in what we did together. So as Craig stole our thunder there, 3,816 responses. We're really proud of that. That was an improvement of over 1,300 from 3 years ago. Lots of data is good, but good data is better. And so it's not just the number of responses for me, but it's that it was demographically representative of our community, which is the most important piece. That's how you know that the answers are real. what people put in the survey. So we were very representative of our community. We missed the mark in 2 areas. One was we needed more men to take the survey, and the second was our Hispanic Latino community. We could have used a few more percentage points there to actually replicate our community. So we'll be working on that 3 years from now. We also did targeted roundtables, so because we know that there are groups that won't hear about the survey, won't think it applies to them, don't want to take the survey, we go to them and we do a very informal roundtable process, just asking them some questions, and then we ask them to take the individual survey as well. So lots of survey, lots of opinions, personal perceptions. And so then we also look at data. So not just county level demographics, but we look at county health rankings and how we compare to other counties as well. We all came together in a town hall back in May to actually prioritize then this is survey responses, data says, and then we came up with the priorities. So priorities identified are behavioral health, which would include mental health and substance use, food security or access to healthy foods. Obesity was a top need in the survey, and the stakeholders at the town hall wanted to start with healthy eating options. So that's the food security piece. Neighborhood safety and safe, affordable housing. This is the first time this has shown up in a community health needs assessment. And I think it's because it's very reflective of what's going on in our community right now, both from a violence intervention and assisting individuals who are homeless. And then health equity stayed as our 4th priority. That gives us an opportunity to delve deeper into those health disparities that are identified in the county health rankings. And so we're excited to get started on that work. But as Craig said, as proud as we are of the survey process, what's most important is what comes next.
So what does come next? So again, another slide that you guys have seen before, but to me, I think it really personifies the process, as it is cyclical, it is continuous. And so right now, we've already talked about recruiting additional partners. We're adding KDHE. One of the really exciting things for our next stage and level of work is to, oh, we got to stand up. Yes, active meeting, we're on the hour. Exciting, very good. And so perfect time to do this during a Board of Health meeting. So we're excited about adding KDHE because one of the really exciting things for us as we look at both our needs assessment and our community health improvement plan is overlaying that and doing a strategic crosswalk with the state's health improvement plan. So overlaying those strategies to ensure that we as a community also position ourselves very well to go after those dollars that the state provides, but then also other local or state or even federal foundations and funding sources. So the next piece that we'll be moving into is the development of our community health improvement plan, but we are ongoing right now sharing the data. So we're working with our stakeholders, we're providing those nice handy 66-page documents that I know you all have read very clearly. Yes. All right. And so that is, we're having those meetings with all our stakeholders now. So we're going through the data, we're pinpointing specifically the data that's in there with those stakeholders that they can use for their own internal strategic planning process, especially as we're going into that process for the 25 year as well, as they're all looking at their own strategic plans. So, looking ahead, and I will try not to steal too much thunder from Sarah Carnes, she's going to be presenting next, but Live Well Shawnee County is going to be taking the lead on the CHIP development. And so they have applied through the KUMC to look at some partnership grant funding to expand our CHIP development. So we already talked about that a little bit, and then also to further integrate with the state health improvement plan. So our steering committee will begin meeting on a monthly basis to outline and develop plans and coordinate for next steps. And the work groups will begin analyze existing work and look towards future objectives and strategies. So that work is already happening. Those work groups are already looking at the needs assessment, the data that was provided in there, looking at the existing community health improvement plan, the objectives, the goals, the strategies we have outlined there, looking at what have we accomplished, what do we need to work towards, are these strategies still applicable for that next 3-year cycle? And then our CHIP, our Community Health Improvement Plan. The goal here is to have that written document outlined with our new goals, strategies, and objectives, those opportunities for community engagement to be developed by the end of the 25. And so that next CHIP will be for our next 3-year cycle that we'll be running from 2026 to 2028. So I know that was a fast threw at you real quick there, but you guys have been hearing about the needs assessment for a while, so we're just excited to formally announce that it is out there, it is public, it is out on web pages for electronic viewing, and then we have those hard copies that we are meeting with partners and handing out so that they can do what I do and put a bunch of little bookmarks in there and write and scribble in all the margins. So if you guys have any questions for myself or for Carla on the needs assessment, happy to answer them for you today.
Questions? All right, thank you.
Awesome, thank you so much.
Good morning, commissioners. I know I'm last on the agenda, so I'll try and make it short but sweet too. So I'm Sarah Carnes, the director of Live Well Shawnee County. Thanks for your time. Thanks for giving me the chance to kind of report on where the coalition is and where we're going. It's been a big year for Live Well, and I was thinking through on my drive this morning, you know, when I started this position in 22, I saw so much momentum that was happening with this coalition, and I feel like it's only grown, and we're only like just getting started too at the same time. So really exciting things there. I'll just talk about a few things. We're really excited to see how the community has come around us in terms of financial investment and many other forms of investment too. But that includes you all, that includes the county, and we're really appreciative of that investment. We've gone from being funded by solely one grant to a multi-pronged investment approach, which has been the goal and continues to be the goal. As part of that investment from the county, I'll be planning to attend these meetings regularly so I can offer updates and answer questions that you may have. And of course, I'm always just an email away as well, but that's my commitment to you all, is to be at these meetings regularly from here on out. Talking about, or moving on from what Craig and Carla presented on that community health needs assessment, we are moving into the community health improvement plan, and that's something that Live Well sort of takes the baton and goes forward with. So that will be a major part of our work this year, and I'm excited to present it to you a year from now and talk about our goals and objectives for how we plan to address those needs that Craig and Carla touched on. Some of the needs that they mentioned, the mental health collaborative or the mental health piece, we're excited to continue our work there. Brian Cole is part of the collaborative, so we're excited for that partnership and that alignment with the work that the county is doing. Some other in just partnerships I'm thinking about as I'm sitting here, I think almost everyone over in this section is on a work group or the leadership team or both. So we're excited to continue that alignment with the county's initiatives. Yeah, I think just overall, we're so much better positioned this iteration of the CHIP to mobilize, to leverage these partnerships that we've grown in over the last few years to really, use the stakeholders that are coming to the table that we've developed over the years and move forward. I'm saying this is going to be the best CHIP yet, so you can hold me to that a year from now. Another big part of our work that aligns very closely with the Community Health Improvement Plan is our Pathways to a Healthy Kansas grant initiative. If you remember, it's been over a year now. We did a check presentation up here for the Master Trails Plan update. That work continues, and That was a big, big contribution from Pathways. That grant initiative ended in July. We have applied for the third phase. Blue Cross has said that their regular investment in Kansas will be to do more of a 2-year cycle, which this next phase will be. So please check out our Facebook page on December 18th or around there. Really hoping for a big announcement. That would be a $100,000 investment into initiatives in Shawnee County that touch on active living, healthy eating, and commercial tobacco cessation, all of which help to improve the lives of those in Shawnee County. So really hoping to continue that work. Some other Pathways things you may remember or might not know that align with county initiatives. The Rossville Trail, I think Commissioner Rippon, you were there at the big ribbon cutting that we did. Safe Routes to School was partially funded by Pathways, and those are just a few. Let's see. I think, yeah, I just want to talk next about where we're going in the future. You probably all saw my email invite, but I'm gonna head back to my office today and make sure you get another one. We're having our annual action summit this Friday, December 13th from 9 to 1 at the library. Would love to see you all there. I think your attendance would be really valuable to the purpose of the meeting. We get to do this once a year. It's only 1 or 2 times that the whole coalition is together. And so for that, it's really nice just for building energy as we move into the next year. But I think also you get to see, you get to celebrate successes where Shawnee County has grown in the last year, and take that momentum, that energy that is produced in the room at the event, and apply it to writing goals and strategies for work that our 7 work groups focus on and work so hard on throughout the year. It really is just a beautiful representation of sectors coming together. There will be coalition members and the leadership team, but also business owners, community members that are just interested in public health. It's a good intersection of that, like economic development and public health that we know we need both of in order for our county, our community to thrive. So I, once again, would love to see you there. I've got over 70 registrants at this point, and would love for you to join us. And that's my main focus right now this week, and then lots more to come in the next year for Liverpool, Shawnee County.
Triple. Commissioner Mays?
Nothing from me.
All right.
Thank you.
All right.
Well, good luck.
Yeah, thank you so much.
Just going to wrap us up. I hope you enjoyed hearing about some of the work that we've been doing in-house and across the community. And I think, much like the Department of Corrections said, you know, their initiative doesn't belong to just their department. This is a solid reminder that public health also does not belong to just the health department. Public health belongs to our entire community. And hopefully today was a showcase of just the partners that are invested in the work that we're doing and opportunities to get involved. So we'll look forward to bringing you our next Board of Health meeting this coming spring.
Well, Dr. Locke, you haven't had a chance to say anything this whole meeting. I know that it would be a Board of Health meeting if we let you off the hook.
Hi, I'm Dr. Locke. I'm the health officer. Is it okay if I just say hi?
Yes.
I'm actually very glad I've not had to come up and speak to you for any reason.
No offense, us too.
Yeah. I love working with the health department and our community partners. We do have a wonderful community here, and I get to dabble in a little bit of everything. And with our regular health officer meetings, we work to continue to advance it. So, I'm always here if you have any questions. Thank you.
All right. Thank you. All right. That draws us to public comment. Is there any members of the public wishing to have a comment? Seeing none, then we come to administrative communications. This is an opportunity for any employee or department head to address the commission. Seeing none, then we are adjourned. We will resume on Thursday for a regular meeting.